My name is Andrea Nays, and I am a student nurse practitioner student at Maryville University. I'm going to be performing a head-to-toe assessment. This is my friend Amanda, who's agreed to be my patient for today. Before we begin, I had Amanda change into a gown. She emptied her bladder. I measured a full set of vital signs, her height, weight, and I also measured her distant vision using the Snellen chart and her near vision using the Rosenbaum chart. I've washed my hands and I'm now ready to begin. First, we're going to begin with general inspection of the head and face. I'm looking at the position of the head, making sure that it's midline. I'm looking at the external characteristics such as her eyes and ears, making sure that they are symmetric with each other. I'm looking at the color of her skin. I'm looking for any rashes or lesions. Looking at the skull, making sure that there aren't any bulges or masses, anything like that. I'm going to palpate her scalp, making sure that it is normal cephalic and that the scalp is freely movable over the skull, noting for any masses or lesions. I'm then going to palpate the hair, noticing the texture, color, characteristic, making sure that it is evenly distributed throughout and if there's any split ends or areas of alopecia. I am then going to palpate her facial bones, making sure that there aren't any areas of tenderness or masses. I'm then going to palpate her frontal sinuses and her maxillary sinuses for any areas of tenderness or swelling. I'm next going to palpate her temporomandibular joint. I'm going to have you open and close your mouth. And I'm noticing for any popping, clicking, or pain, which I don't see any. I am next going to put Amanda's face through a motion of series. I'm going to be checking some of her cranial nerves, and while she's doing this, I'm going to assess her face for symmetry. Can you smile? Can you stick out your tongue? Can you clench your teeth? Can you puff out your cheeks? And can you squeeze your eyes shut and wrinkle your forehead? Good. Everything was symmetric. I'm now going to test the light sensation on her face. I'm going to have her close her eyes, and I'm going to test it on her forehead. Can you feel that on both sides? Yes. Her cheek? Yes. And her chin and jawline? Yes. Great. I'm now going to move on to the assessment of her eyes. I'm noting the position on the face. I'm looking at the eyebrows and that they extend outwards toward the temporal canthus. I'm inspecting the eyelashes, looking at the hair, making sure it's evenly distributed and that they curve outward and up. I am going to take my pen light and I'm going to assess the pull down on the lower lid and assess the sclera, which should be nice and white, and the conjunctiva. I'm noting for any redness, swelling, or drainage. I'm next going to have you close your eyes. I'm going to palpate the orbitals for any nodules. I'm going to palpate the lacrimal gland as well for any tenderness, and there should not be any discharge. I'm next going to check her pupillary response. I'm going to make sure that her pupils are equally round and reactive to light and accommodation. I'm going to have you stare at an object on the wall, and I'm going to check direct, consensual, direct, and consensual. And both of her eyes equally restricted or constricted and reacted. Next, I'm going to check the muscle movement and balance of her eyes by performing the cover and uncover test. I'm going to have her stare at the wall. I'm going to have you cover your right eye, uncover, and cover your left eye, and uncover. And they both reacted, and I'm looking for any areas of nystagmus or any irregular movements. I'm also going to check her extraocular movements by performing the 6 cardinal fields of gaze. I'm going to have you follow my pen light with just your eyes. Here I'm looking for any ptosis, any nystagmus, or any irregular rhythmic movements, and I did not see. Next, I'm going to move on to the assessment of her ears. I'm noting the position on the head and that they are symmetric with each other. I'm inspecting the color. It should be the same color as the facial skin. I'm looking for any rashes, lesions, any irregularities, and I don't see any. I'm next going to palpate the auricles for any nodules, and they should be nice and firm and mobile. I am going to take an otoscope. I don't have one, but I would inspect the inner ear canal. I would take the auricle and pull it up and back and slide that canal or slide the otoscope in, and I would be looking at the inner canal for any redness, swelling, or drainage, as well as looking at the tympanic membrane. It should be a nice pearly gray in color, translucent, looking for any perforation or bulging at this point, and I did not see. I am next going to perform the whisper test by testing her hearing. I'm going to have her occlude her right ear. I'm going to whisper a word, apple, and occlude your left ear, orange. I'm next going to test for unilateral hearing loss. I'm going to be performing the Weber test. I'm going to strike my tuning fork and place it in the center of her head. And I want you to let me know if you hear this equally in both ears or better in one or the other. I'm next going to perform the Ryan test, and this checks to see if the patient hears better by ear or bone conduction. And I'm going to strike the tuning fork and place it behind on her mastoid bone. And I want her to let me know when she no longer hears the sound. I'm going to be timing this. And then when she can no longer hear it, I'm going to hold it about 1 to 2 centimeters in front of her auditory canal. And she'll let me know when she can no longer hear it. In a normal finding, that ear conduction should be heard twice as long as bone conduction. Next, I'm going to assess her nose, looking at the position on the face, that it is even. I'm looking at the color of the nose. It should be the same color as her facial skin. Looking for any redness, lesions, any drainage. I'm going to inspect heavy lookup, and I'm going to look at the nasal mucosa. It's nice and pink. I'm looking at the nasal septum to make sure it's not deviated, and I'm looking at the nasal turbinates as well to make sure that there isn't any swelling. I'm going to check for nasal patency. I'm going to have you occlude your right nostril and take in the breath, and your left nostril and take in the breath. Be able to breathe equally out of both of those. Great. Now I'm going to move on to the assessment of the mouth and the pharynx. I'm first going to inspect her lips, looking at the color. They should be nice and pink and full. Noticing any areas of cyanosis or cracking. I'm going to have you open your mouth. I'm going to check the buccal mucosa. It should be nice and pink and glistening. I'm going to look at the tongue. You stick it side to side. And then up. I'm noticing for any lesions or ulcerations on her tongue or the floor of the mouth, noting or anything that would indicate oral cancer. I'm going to look at the teeth, the color, the texture, and the characteristics. I'm going to have you open your mouth again. I'm going to look at the uvula, the oropharynx and the pharynx, the anterior and posterior pillars, and the tonsils. I'm going to have you say ah, and I'm making sure that the uvula rises symmetrically. Next, I'm going to test the gag reflex. I would take a tongue depressor and touch the posterior part of her pharynx to test the gag reflex. I am now going to move on to the assessment of the neck. I'm noting that the neck is midline with her head, that it is not tilted to one side or the other. I am noticing the color of the skin, noticing for any rashes or lesions, making sure that her trachea is midline, and I'm looking for any fullness at the base of the thyroid that would indicate any thyroid disorders. I'm going to palpate the neck for any tenderness, and I'm going to palpate the trachea, making sure that it's midline. as well as the thyroid. Swallow. On here, I'm going to palpate the carotid pulses one at a time, noting the rate, rhythm, and intensity. And I'm also going to assess for any jugular vein distension, which none is noted. I'm going to palpate the lymph nodes, noting for any swelling or areas of tenderness, starting with the preauricular, postauricular, the occipital, the tonsillar, submandibular, submental, superficial cervical chain, posterior cervical chain, deep cervical, and supraclavicular. I'm going to test the range of motion upper neck. I'm going to have you turn your neck to the left, to the right, opposite down, and back, and then turn it side to side. I'm going to have you shrug your shoulders. I'm going to try to do this again against resistance. I'm also going to take the bell of my stethoscope, and I'm going to auscultate her carotid arteries and her thyroid, listening for any breweries. I'm next going to move on to the assessment of her upper extremities. I am noting her hands, arms, and shoulders. I'm looking at the color of the skin, looking at the texture, noticing the hairs evenly distributed, noticing for any rashes or lesions. I'm going to feel for the temperature and palpate the turgor, the skin turgor. And then going to look at the nail beds and look at the capillary refill. Hers is less than 3 seconds. And I'm noticing for any clubbing or cyanosis or nail brittleness. And then going to palpate the brachial pulses. Comparing them each, noticing the rate, rhythm, and intensity, as well as the radial pulses. Good. I'm now going to have you turn around. I'm going to assess the posterior portion of the back. I'm going to note the thoracic configuration and that the AP diameter should be 1 to 2. I'm going to percuss and palpate the costovertebral angle using indirect percussion. This should not elicit any pain. I'm next going to just do a general inspection of the thoracic area back here. I'm noticing the skin color, noticing if there's any rashes or lesions. I'm noticing her respiratory rate and rhythm. It's nice and even and unlabored. Her respirations are less than 18. There's no use of accessory muscles or any diaphoresis. I am going to palpate for tactile fremitus. And with this, I'm going to have her say 99, and I'm going to be noticing any decrease or absent vibrations that would indicate any air or fluid. You say 99, 99, 99, 99, 99. I'm also going to palpate for thoracic expansion. I'm going to place both of my hands at the 10th rib. I'm going to have you take in a deep breath. And then making sure that both of my hands rise symmetrically, not one is higher than the other. I am next going to percuss the posterior portion of the chest as well as the lateral, using or in between the intercostal spaces, noting for any areas of dullness or hyperresonance. comparing each side to the other, and I'm going to do the lateral side as well. I am now going to percuss for diaphragmatic excursion. I'm going to have you lean forward a little bit, and I'm going to have you take in the deep breath and hold it, and I'm going to percuss until I no longer hear a sound, and I'm going to mark that. Go ahead and breathe. I'm going to have you take in another deep breath and blow it out, and give it out. I'm going to mark that as well, and it should be about 3 to 5 centimeters in a normal finding. I'm next going to auscultate the posterior portion of the chest, noticing for any adventitious breath sounds, any wheezes, bronchi, or wails. Taking a deep breath. I'm doing this in a bilateral fashion, comparing each side to the next. I'm going to compare the lateral sides as well. Great. I'm going to have you turn around now. Now I'm going to inspect the anterior portion of the chest. I am going to note the skin, the color, if there's any diaphoresis. I'm going to note if there's any rashes or any irregularities. I'm going to note the respiratory rate and rhythm. She's not using any accessory muscles. It's nice, even and unlabored. Respirations are about less than 18. I am going to palpate the chest wall, noticing for any areas of tenderness. I'm also going to palpate the infraclavicular nodes for any swelling, as well as the axillary. I'm going to palpate the precordium, noticing for any lifts, heaves, or pulsations, as well as the point of maximal impulse, noticing the rate and rhythm. I'm next going to palpate for tactile fremitus, as we did on the back, noticing for any decrease or absent vibrations that would indicate any fluid or air buildup. 99, 99, 99, 99. Next, I'm going to percuss the anterior portion of the chest, comparing each side to another. I'm now going to auscultate the anterior portion of the chest, noticing for any areas of adventitious breath sounds. Taking a deep breath and release. And I'm comparing both sides to one another. I'm also going to auscultate the heart sounds. We're going to start at the aortic, which is the second intercostal space. And then pulmonic. First point. Tricuspid. And the mitral valve, which is the point of maximal impulse for the apex. I'm now going to have her lay down and I'm going to inspect her abdomen. I'm going to take a pen light and note the contour of the abdomen. I'm going to note the color and texture, noticing for any rashes or lesions. I'm going to also note for any pulsations that would indicate an aneurysm or any bulges that would indicate a hernia. I'm going to also take first. We're going to start in the right lower quadrant. I'm going to listen for up to 2 minutes in each quadrant. Going up to the right upper, the left upper, and the left lower. And I'm noticing the frequency and characteristics of the vowel sounds. And while I'm here, I'm going to take the bell of my stethoscope and also take the aorta, the right renal artery, the left renal artery, the left iliac artery, the right iliac artery, the right femoral, and the left femoral. Next, we're going to percuss the abdomen, noticing for any areas of dullness or hyperresonance. We are then going to palpate for the liver border. I start mid-clavicular and kind of percuss down until I hear a change in sound. I would mark that, and then I'll start down here and percuss until I hear a change in sound. And mark that. A normal finding should be about 12 centimeters. I'm going to percuss the spleen next in the same way, noticing for any change in sound. Next, we're going to lightly palpate all 4 quadrants, noticing for any areas of tenderness, bulges or masses. And then we're going to deeply palpate. We're going to palpate for the liver. I'm going to place my hand underneath, and I'm going to do under the costal margin and kind of press up under the costovertebral angle and palpate there. And then for the spleen, I'm going to place my left hand under the patient and push up and palpate. And in a normal finding, you should not be able to palpate the spleen. If you do, it can indicate splenomegaly or inflamed spleen. I'm going to palpate the kidneys. I'm going to push up under the costal margin with my left hand, taking a deep breath and hold it. You normally should feel the kidney. And same with the right side. Push up, taking a deep breath and hold it. Palpate. I'm also going to palpate the aorta with the thumb of my forefinger. And I'm going to have you slightly raise your head. And I'm going to palpate the abdominal muscles as well. Alright, you can sit back up. I'm going to move on to the assessment of the lower extremities. I'm noticing the color and texture of the skin. I'm going to palpate for the temperature. If there is hair, I'm making sure that it is evenly distributed. I'm going to check for skin turgor. And I'm going to check capillary refill at the toes. I'm going to make sure that there isn't any swelling in the lower extremities. I'm going to palpate the pedal pulses in each foot, comparing the rate rhythm and the posterior tibial and the popliteal. Also going to test the light sensation on your lower extremities. I'm going to have you close your eyes and just let me know if you feel a dull or light sensation or sharp. Dull. Light. Light. Dull. I'm going to move on to the musculoskeletal system. I am going to check reflexes in the brachial and in the radium, and on the other side, in the radium. Going to check the reflexes in the knee and Achilles tendon. And that should elicit a little movement in each. I'm going to test the muscle strength in the arms. I'm going to have you hold your arms out to the side and push up, and push down. Great. I'm going to have you push forward with your legs and back. Push up with your feet, and then push down. I'm going to have you stand up. Turn around. I'm going to look at the cervical side, making sure that it's concave and that it's erect with the head. I'm going to have you bend over, touch your toes. I'm looking at the lumbar spine, making sure that it's straight and there aren't any curvatures that would indicate any scoliosis or anything abnormal like that. Okay, you can stand back up. That concludes the head to toe assessment. Thank you.
That was really good.